So I can see, Nurse Jennifer, that this bag is kind of huge, and I can understand using that at night when you're sleeping and hanging it off the bed below the level of your bladder. But you know, what if I want to go to 7-Eleven and pick up some chips for the game or something during the day? Do you have something smaller?
Yes, I do. I have what's called a leg bag. A lot of patients prefer this. Now, this is a small bag. It holds 32 ounces. So you don't have a lot of time between when it fills and when to empty it. So if you're going somewhere for quite some time, just expect you're going to have to go out into the bathroom and empty it.
So instead of 4 hours for this, maybe half the time for that?
Yeah, I guess so.
Okay.
I think it just depends on how much you're drinking.
Just keep your eye on it.
Keep your eye on it. Yeah, I would think your pant leg might bulge a little bit, but most men that have them, I can't tell that they have them on.
Really?
Or women, I should say.
Okay, you wear them under your clothing?
You wear them under your clothing, but I thought I could show you just on top of your clothing here how to do it.
Okay.
The leg bag is great because no one knows you have a catheter. However, the first day of your surgery when you go home and for the first night, we prefer it if you use this big bag. And the reason for that is because at that time you're diuresing a lot of fluids.
Diuresing?
And you're getting rid of a lot of fluids, sorry. And we want you to be kind of restful when you first go home.
Right.
We don't want you up every 10 minutes in the bathroom emptying your catheter. That would happen with this small bag. So while you're recuperating for day number 1 and always at night, I would put this bag on.
Okay.
I've had patients that use this smaller bag at night, but I think that they're up more. And your sole purpose after is rest. Correct.
Okay.
So this is a leg bag. You want to keep this green cover because it keeps everything clean when you're not using the bag.
Okay.
So while you're using this bag can just be set aside.
Okay.
And vice versa. While you're using this leg bag, I recommend patients set this in the bathtub or the shower so that it stays clean, the dogs don't get it, or what have you, because you never know what pets are going to do. This leg bag comes with holes at the top and holes at the bottom, and we send you home with 2 straps, one for the top, one for the bottom.
How do you weave those through?
You just weave them through. Now there's Velcro on these straps. If these straps are too big for your leg, it's okay to cut them. You just have to make sure when you cut them that you leave the Velcro. You don't want to cut this end because that's the only Velcro connection. This one you have a little more length. Okay, so we thread it through the top and around.
I see. I have chicken legs, so you will be cutting that off for me.
Yeah, exactly. And patients come in all different sizes, so I have never had one be too small.
Okay.
But we'll figure something out if you were here and you needed something bigger.
Velcro strap up.
Yeah. So this comes around. Now, first we need to talk about how you connect it. It's easier if you get this all hooked up before you pin this, I think, to your leg.
Okay.
So what you do is, once again, just as we did for irrigation, you're going to separate this heavy plastic tube from the smaller tube.
Remember to kink it first.
You're going to kink it first, and it takes a little force, and you separate them. Then while this is separated, you put your clean cap on it to keep everything in here clean and no bacteria going in and out of this. You're going to set that in your bathtub or in the shower. And then you take off the green cap and connect the same place where the tubing came out before.
Make sure it's good and secure.
Make sure it's secure. You don't want to have any leakage. The other thing is you need to make sure that this lever here is up. If the level is down, it would be emptying urine. This is how you empty it into the toilet.
I see. Okay.
You just put your valve down, empty the urine, put it back up. You may need to wipe this. You don't want this to get on your clothing, so maybe wipe this with a tissue. Okay, then I'm going to show you how to put it on your leg. So you would just take, I'm going to hold this tube because this would be up inside your bladder.
Correct.
And then you could just fasten this around your leg.
Just like that.
Yeah, and see, his legs are thin, and even though we have the clothing, it's still a little big for him. But, oh, this needs to go through here, Tim.
Is that my fault?
I don't know. I think it just came out.
Okay, yeah. Got it. So it would be attached like that?
Correct. And that would be underneath your pants.
Mm-hmm.
A lot of people put it towards the inside of their thigh or the outside of their thigh. It's just whatever's comfortable for you. I would think it'd be more comfortable on the inside though, because you may have less pull on the tubing at that point.
Yes, correct.
Is that clear?
Very clear.